Welcome with another video tutorial regarding the anti-cancer chemotherapy. This video lecture is also available in Urdu or Hindi. Go to the Facebook or YouTube, type Dr. UUT and the topic name, you will get the video. Let's continue in English. The topic name is chemotherapy resistance. How the tumors or the cells show resistance. In the following three ways: primary resistance, secondary or acquired resistance, pharmacological, sanctuaries resistance. How the primary is available? Available drugs that you have for specific chemotherapy that is not showing any sort of action if you give the specific drug to the patient. That is called primary resistance. The drug is available, but if you give, it shows no action. Acquired resistance. What is this? Secondary one or acquired? The name itself is telling you just to concentrate. It is acquired, means that it is the resistance that a tumor or a cell shows during the therapy for the specific chemotherapy. Chemotherapy you are giving to the patient and the patient shows resistance, or the tumor shows resistance, or the cell shows resistance. This is called acquired or secondary chemotherapy resistance, which is during the therapy. What happens? The phenotypic gene is activated, that is called as MDRI gene. This gene is responsible for the production of P-glycoprotein. And P-glycoprotein, if they are produced, actually they are transported, they are produced on the surface of the cell. Their action is to pump outside, actively pumping or transporting the medications, the drugs or the natural products from inside the cell to outside. Why? That then those medications or those drugs or those natural products may not accumulate inside the cell to produce a toxic effect and to produce any effect inside the cell. So that's why then those drugs will not show their action, or those medications or those natural products, they will not show their action inside the cell. Like that, the secondary acquired resistance is achieved. In short, what is secondary acquired resistance? It is acquired during therapy by means of activating MDRI gene, which will produce P-glycoprotein, and this P-glycoprotein is responsible for throwing outside of the cell all those medication, all those drugs, all those natural products. If they are not getting inside the cell, they will not accumulate inside the cell and they will not show their toxic effect on those tumor cell. Then what will happen? Our pharmacology or our chemotherapy will not be active to treat the tumor. Then that tumor will be available for its own production, that will proliferate. Then that tumor will spread throughout or will show its action. Means we were supposed to stop. Because of secondary resistance, we are not about to stop that resistance now. What is the pharmacological sanctuaries? It is actually the chemical that you are giving to the patient that fails to reach the tissues. That is known as pharmacological sanctuaries. The medication that if fails to reach the tissues is known as pharmacological sanctuaries. And now this is also a type of resistance. Why? Because you are giving the patient the specific medication or the specific chemotherapy, but that chemotherapy, that chemicals are not able to reach the specific tissues of the brain, ovaries and testes. Then these cancers are not supposed to be treated, or those tumors will remain the same, or those tumors can have proliferation, or they can have excessive growth if they want. So like that, a tumor can have resistance. Primary, secondary and pharmacological sanctuaries.